Each year, 1 in 4 nursing home residents are transferred to the emergency department by ambulance. Transfers to the ED can take a toll on older people. In nursing homes, they are used to regular routines and familiar faces. But in the ED, they have no privacy, no distinctions between day and night, and limited assistance with personal care. It's a perfect storm. Older people often return to the nursing home with bed sores, reduced cognitive function, and feelings of distress. Most of the time, these transfers are necessary, but research shows that about 20% of cases could be avoided. Because transfers can have such a harmful effect on residents, it is worthwhile to minimize avoidable transfers. So, what are avoidable transfers and why do they happen? All transfers are the result of a complex decision-making process, like a puzzle, with many key people and the policies that affect them. To explore this puzzle, we designed a research study to find out how these key people decide when to transfer residents and how they define an avoidable transfer. First, we used focus groups and interviews to talk with those who are more closely involved in the decision-making process. Then, we used what these key people told us to design a survey that we shared with a much bigger sample. This is what they told us. A resident's transfer to the ED can be considered avoidable if diagnostic testing, advanced clinical assessment, and treatment can be accessed in the nursing home facility in a timely manner. Or if the increase in disorientation or discomfort of a resident outweighs any potential benefit of the transfer. Or if it's against the resident's wishes, expressed over time through both formal and informal conversations. Avoidable transfers are not caused by any one piece of the puzzle, but each piece can play an important role in preventing them. Here are some things that each key person can do to help reduce avoidable transfers. Residents' care providers can ensure that any conversations about advanced care plans are documented and updated regularly. The best care option for a resident should reflect their wishes. This takes regular communication between staff and families. Family members can request regular updates on their loved one's conditions from nursing home staff so they can view any change in the resident's condition in the context of their medical history. Healthcare aides can make sure to report any changes in a resident to the nurse on shift, as well as document what they observe so that long-term changes can be tracked. Healthcare aides know residents well, so early signs of illness are more likely to be reported when they are valued as a part of the decision-making team. Licensed practical nurses and registered nurses can take time to do a thorough clinical assessment and consider all the care options available before reporting to physicians. Nurses should also communicate regularly with family members. This includes preparing families for expected changes in their loved one's health and also reassuring them when there are unexpected changes. Nursing home managers can empower staff by providing constructive feedback on their transfer decisions, and they can set clear expectations for communication between staff and physicians, as well as between staff and families. They can also advocate for better access to lab tests and x-rays at the nursing home facility. Emergency medical services staff can help by taking time to learn about the capabilities and limitations of a nursing home facility. It is also important for EMS to remember that the definitions of acuity and severity are different for older people compared to other populations. ED nurses and doctors can help by documenting all conversations with the resident around changes to their advanced care plans. Finally, changes to healthcare policies and systems can help by redistributing resources so that better care is available to older people outside of the ED. Nursing home residents have more complex health needs than at any other time in their lives, so advanced care options need to involve the collaboration of multiple healthcare sectors. As you can see, avoidable transfers are part of a complex puzzle that includes all the people involved in making decisions to transfer residents to the ED, as well as the resources they have and the barriers they face. Each person can play a role in reducing avoidable transfers, because improving care for nursing home residents is in everyone's best interest.